All right. Hello, everyone. My name is Jessica Bender. I'm very excited to talk with you all about the Global Health Pathway here at the University of Washington. I'm the director of the pathway. I'm also a general internal medicine physician. My clinical time is mostly at Harborview Medical Center, and I do mostly outpatient primary care, transitional primary care, but also love to attend on the wards. So, I'm excited to talk with you about the Global Health Pathway. We'll talk through the key elements of the pathway, which are fairly similar to the other pathways. Really, our foundation of this pathway is the immersion block. You'll have a scholarly project that you do. There's mentorship and community building, and then an optional clinical elective. Well, let's talk about the immersion block, which is block 4. We just finished this month together. And during this immersion block in the Global Health Pathway, you will take the Department of Global Health graduate course, Global Health 575, called Global Health Leadership for the Clinician. I teach this course along with Dr. Colette Abbott, who was the pathway director before me, and it's a really fantastic month. I cannot stress that enough. You spend the morning in this course and then afternoons maybe for clinic or other activities. And the course has several key components. There are more traditional lectures, we do site visits, and there's also a group project. So I'll talk a little bit more about these in more detail. Here are some examples of our lecture topics. Some of these are more traditional lectures, some of them are small group discussions, and we try to start in week 1 and 2 with broad foundational global health topics, and then as we go on, we move towards more clinical topics that may be of relevance, as well as more local topics, this idea of local, global, global-rural overlap. So it's really great. This picture shows our class. We hold the class at Harborview in the Ninth and Jefferson building, and we're zooming in with Eliza Monroe Weiss, who was the first chief resident in Naivasha, former UW resident, and still lives in Kenya. So she's very generous with her time and her evenings when it's our morning to talk about current issues in global health. You can see that this class size is more than 2 or 3 residents. So Global Health 575 is not only for internal medicine residents, it's for really any residents, graduate students, fellows who are interested in global health and are clinicians. So we tend to have residents from internal medicine, family medicine, sometimes OB/GYN or pediatrics, emergency medicine, anesthesia. We've had a radiation oncology resident 1 year. We're lucky that often we have family medicine residents from Malawi who come join us for the month. This is through a partnership with Swedish. This year we have an implementation science PhD student who's also a physician from Kenya who joined the class. So it just makes for a richer learning environment. Some of our site visits, of course, include the Gates Foundation. We're lucky in Seattle. There are many global health organizations based here. And you can see the photo on the left. Some of our anesthesia residents were intrigued by the iron lung that they had at the Gates Foundation. And then a photo of the group at Village Reach, another global health NGO that does a lot of community health work and health system strengthening work. We have the students in the class do a group project. This has evolved over the years, but the last couple of years we've had folks do a mock grant proposal because it turns out even if you don't want to, do research in global health, you need to get your work funded and programs funded. And we found that this was a skill that some of our residents said they didn't have much experience with. So it's been really successful, I think. I wanted to share some of the projects from this year. I think they're great. One is in Nepal. It's about reducing perioperative complications by using a sort of rodeo-like model that we do at Harborview for rapid OR decisions. The next project took place, or theoretically took place in rural Kenya, doing tuberculosis screening and patients receiving methadone. And then moving closer to home, the Aspire project, assessment of STI interventions in Pine Ridge Reservation, our global rural health fellows who also participate in the course may actually decide to do this project, which is great. And then finally, super close to home, there was a group that wanted to focus on cervical cancer screening for Somali immigrant and refugee women in King County. Okay, so let's move on to the next pathway element, which is the scholarly project. So you will have 2 or 3 research blocks, depending on if you do a clinical global health elective. These will be split between your second and third years. Key here, you need to identify a mentor and a project idea before you apply for the pathway. We'll talk about that more at the end and how you can do that. I wanted to show you a list of some of our current Global Health Pathway residents and recent graduates. You can look them up and see what kind of projects they're working on, or you can reach out to them and ask, hey, who's your mentor? Who did you meet with? How did you find a mentor? It takes some time to do. So I encourage you to start now if you don't have an idea already. And then I wanted to share from our 2025 graduates some of the work that they did. Sharmila Paul, who's now a pulmonary critical care fellow, did work with David Watkins. One of her projects was strategic health systems investments to improve critical care capacity and pandemic response in low and middle income countries. Dan Olivieri, another 2025 graduate, recently published his project related to cervical cancer correlates in sub-Saharan African countries using the DHS, a very popular, important global health survey. There's other ideas we have if you're interested in a more local global health project. Here at Harborview, the team at Ethnomed has a whole list of projects that they would like to do, but need somebody to sort of spearhead, and that could be related to resources for refugee and immigrant sexual and gender minorities, addressing vaccine misinformation in communities, capturing cultural mediator value from chart notes. Just a few examples. Okay, the next pathway element is related to mentorship and community. There's a couple of ways this happens. Of course, we have mentorship meetings. There's pathway gatherings that we hope to hold over the years. And then in the past, we've done Journal Club. There was a proposal from Carl, one of this year's second year residents, to do a book club specifically for this book written by a former MSF president. So let me know or let Carl know if you want to join us. And then networking, the networking starts when you do your immersion, and I hope that it continues throughout your 3 years, not only with the pathway residents, but also the residents in the other departments who you've met through our class time together. And I just wanted to show some pictures. So one is a LinkedIn screenshot from the team at Ethnomed. They were sharing some of the work we'd done together, the lectures they gave. They also helped run a community tour for us the other week. We got to go to the Othello Station Pharmacy, and here's the owner and pharmacist here. A pharmacy that many of my patients love to go to that is not far from Harborview. And then the last pathway element is an optional element. It's a clinical elective. And this is in Naivasha, Kenya, not too far from Nairobi. And this is through the CEPI program. It's a longstanding educational partnership between the University of Washington, the University of Nairobi, and Naivasha County Referral Hospital. So if you are a pathway resident, you can do this rotation, but that means you will have 2 research months instead of 3. If you are not in the global health pathway, you can also do this rotation. So think about it if you're interested. It requires a little bit of planning with your schedule and foresight, but it's absolutely doable and a really great experience in clinical medicine, medical education. Thank you to Colette for these slides, and she was a former chief resident there, so you certainly could reach out to her if you have questions, or our current chief resident is Monica Soni. So now that you've decided you want to apply for the Global Health Pathway, how do you do it? Well, number one, start thinking about a mentor and a project. You need to identify a mentor and a project with your application. Please set up a meeting with me to discuss your interest and application. This is just to make sure that the pathway is the best fit for you and to answer the questions you have. You can email me, jessi730@uw.edu. And then your application materials will include your CV, your resume, a one-page application, and then a letter of support from your mentor, and email those to me by the shared deadline. Please feel free to email me if you are interested in the pathway or if you're not sure if you're interested and want to talk more. I'm happy to chat. Happy to chat with folks who are interested in global health, even if you don't want to apply for the pathway. The more the merrier. So thank you so much for your time today.